Hi, it's Dr. Epstein. Two types of hair loss we commonly see. One is where there's lots of miniaturization, the other one where there's just loss of hairs. And both can present as thinning, not for patients that don't have any hair, but patients that have thinning. With miniaturization, a little more common in women, but it can occur particularly in younger men. The hairs first go through what's called a miniaturization phase where they get quite thin. And in those cases, those hairs are quite delicate. So medical therapy is really important prior to doing a transplant in the majority of these cases. Miniaturization will put a patient on a minimum of 3, sometimes as long as 4 to 6 months of medical therapy, with anticipated 3 benefits of medical therapy. Number 1, to stop the progression of loss. Secondly, to potentially reverse some of the hair loss so these miniaturized hairs become somewhat thicker. And the third reason is when the transplant is then performed 3 to 6 months later, there's a lower risk of shock loss. Even if the hairs have not reverted from a miniaturized stage to a thicker stage, they're still going to be stronger, more resistant to falling out. So with miniaturization, transplants can easily be done, but typically some medical therapy is usually recommended. As opposed to those patients who present with just frank loss of hairs. They just have lots of spaces between their existing hairs with these hairs that are present not being miniaturized. Those are usually candidates, and that's the majority of patients where I'll proceed right with the transplant. And I'm able to work between the existing hairs, placing 1, 2, 3, sometimes even as many as 4 hairs. If that's the way the hairs grow naturally in the back of the head, I can then go ahead and restore and achieve good density. Thinning with miniaturization versus thinning with loss of hairs. It is a progressive process, so miniaturized hairs will eventually fall out. So eventually they will get to the lots of spaces between the existing hairs. But anyway, those are the 2 typical patterns I see. Much more common to have the loss of hairs as opposed to miniaturization, but I'm able to individualize my approach with every patient. This is Dr. Epstein.